Hi, my name is Renard, and I'm going to present a problem-based learning strategy. This learning strategy can be used in any healthcare setting. For this presentation, I'm going to introduce a problem case scenario to home health nurses at this agency. Good morning, David and Brad.
Good morning.
Do you have information?
Yeah, I was looking over the case scenario here, and she's an 84-year-old female. She's been independent up until now, but she's had an accident recently, and she fractured her right hip, and she's also got, she's had surgical repair, but she's got multiple comorbidities along with it. She's been discharged with orders for home health to evaluate and treat with physical therapy. So obviously she's got mobility problems, and she's also had a loss of independence here. She's got a daughter that's her caretaker, but the daughter is very concerned about her mother. She's under stress because this is a new situation for her too. The patient has also been discharged with an order for 14 days worth of Lovenox injections, which they're going to need help managing that. So that's kind of the thumbnail sketch. Obviously, she's going to need a lot of help.
Yeah. We should get a nurse in to do an assessment so that we can find out, as far as we cover safety issues, as far as the approach to the house, any kind of steps, rugs in the bathroom, that type of thing, grab bars, or seats in the shower, whatever she's going to need for getting showers. Get a look at maybe doing some teaching for the Lovenox. And what was it, 14 days? You said 14 days, yeah. So they'll be needing some teaching and find out what the caretaker's able to do. If we can do some teaching, maybe assist the caretaker learning some of these things. And get a physical therapist in, yeah.
Evaluation, yeah.
Sure. And maybe, as far as any DME equipment or whatever she needs, walkers, rollers, whatever.
We also should think about her psychosocial needs. Both the caretaker and the mother, they're going to have problems adjusting to this.
Social work.
To this change. Yeah, the patient's going to be trying to deal with loss of independence, probably some fear, maybe even some depression.
Certainly.
So probably should get a social worker in there to do an evaluation.
Absolutely.
Help with that. And she's going to need help for the 14 days with the Lovenox injections. They're not going to know how to give injections. We should probably handle that for them.
Maybe a home health aide as well, if she needs any assistance in dating.
Home health aide would be a good idea, because she's not going to be able to move her mother around by herself, probably.
Find out what we need.
Okay, we're going to discuss this again and see how the patient is doing after we complete the evaluation.
Very good. Okay, good idea.
By getting together and having discussions with problem-based learning, the nurses are able to interact and to share ideas. They brainstorming what the possibility or the needs of the patients are. So we're going to meet again, and we're going to do another evaluation and see how the patient needs are being met. Okay. Let's talk about it. You went to see the patient, you did an assessment, and what did you find out?
Well, we found out that the access to the house was fine, so there was no need to have any kind of construction done as far as ramps or anything. She has a walker, but she's going to need a rollator. There were some rugs in the bathroom. We had encouraged them to remove those. They were removed on the education. But it looks like the caretaker may be able to do some of the shots down the road. We did some teaching the day we were there, and we're going to follow through on that. Hopefully we can get that taken care of.
Okay. I got a report back from the physical therapist, and she's set her up on 3 visits a week to do physical therapy. She's going to treat her for a period of 6 weeks and then do a reevaluation at the end of those 6 weeks to see how she's getting around. And the caseworker, the social caseworker, has also interviewed both parties and is doing some counseling, grief counseling for them as well, so that should help them out with psychosocial.
And I've got a home health aide going out. She certainly needs one. And So we decided to go ahead and put home health aid out there, at least
Yeah.
initially 5 times a week,
Mhm.
take care of some of the needs and follow up on that, see how that works.
By the nurses communicating to each other and sharing ideas, they also this PBL is encouraging and then trying to get the nurses to use their critical thinking skills. So we're going to evaluate and see how the patient's outcomes are there now by the intervention of the nurse and the therapy. So what was the final evaluation? How's the patient doing now?
Patient's doing real well. We completed the shot series and everything. We were able to get the caretaker to take on some of the duties of administering pills. We did some teaching. The patient's very willing to learn, highly motivated, which helps out a whole lot.
Mhm.
It appears she's doing rather well.
From the physical therapy standpoint, the therapist reports that the patient has made progress. She's reassessed her, and she's increasing her mobility, and she feels that at the end of her certification period, she'll probably be able to discharge her from the physical therapy side of it. If her hip heals as expected, she should return to fairly independent living.
Thank you so much. I hope you like the presentation.